Hello, we are Antonio Burguillo and Carlos Alemán, and this is our presentation about the precyclic antidepressant drug called nortriptyline. We will explain how it works and some of the effects that it produces.
This is the European name of nortriptyline. 3-10-11-dihydro 5-8-dibenzo AD cycloheptane 5-iodine N-methyl 1-propamine. And here we have the 2D and 3D structure of the drug.
Nortriptyline is a tricyclic antidepressant, TCA. TCAs are chemical compounds used primarily as antidepressants. All the TCAs have in common the 3 atom rings, as you can see here in another compound called amitriptyline.
The receptor of nortriptyline is dopamine transporter, DAT. It's a membrane-spanning protein that pumps the neurotransmitter dopamine. That is the DAT structure.
In this image, we can see the drug binding between nortriptyline, represented as magenta sticks, and the receptor. Sodium ions are represented as purple spheres, and 1 chloride ion as a green sphere.
Residues in TM1 and TM6 make a lot of interactions with the ligands and ions. One cholesterol molecule is located in the groups TM5 and TM7 and poised to modulate the movements of TM1A that occurs during the transport cycle.
The dibenzocycloheptane ring of nortriptyline has hydrophobic interactions with VAL120, TYR124, and ALA117. The amine group forms a nitrogen bond with the main chain carbonyl of PHE43 and a cation interaction with the side chain of PHE43.
And your signal, where is it? Can you show me where?
This is the hydrogen bond. This is the hydrogen bond. This is the cation interaction, and here we have a hydrophobic interaction with this, and this. With nortriptyline.
The chloride ion is coordinated in a tetrahedral fashion through residues in TM6, SER, 32, GLN 316, TM7, SER 356, and TM2. At the sodium site is coordinated in diagonal bipyramidal shapes by main chain carbonyl from GLY42, VAL45, and LEU417, and the side chain oxygens from SER421 and ASP420.
You know all these letters, what the meaning of all these letters?
Amino acids. The B phase of the sterol ring primarily interacts with the residues of TM5, and also interact with the residues of TM1A. The A phase interacts with the residues of TM7. In LEUT, TM1A undergoes a large conformational change from the outward facing open state to the inward open state. If it were to occur in DAT, it will entirely disrupt the cholesterol side.
The ion and ligand binding sites in DAT are accessible to solvent from the extracellular phase owing to the open gate above the primary binding pocket. The nitrogen of TRP3O caps the carbonyl oxygens of TOR331 and ARG27 forms a salt bridge to ASP435. The C-terminal helix is bound to the face of the transporter via polar interaction with LL1.
Nortriptyline weds between helices 3 and 8 and core helices 1 and 6, preventing the movement of TMs 1B and 6A from closing the extracellular vestibule. Cholesterol is bound in an intracellular pocket and hinders the movement of TM1A.
When the nortriptyline interacts with the subject, it seems to help brain cells send and receive messages, which is turn boost your mood.
Nortriptyline can produce some side effects. Here we have some of them: dry mouth, weight increase, head pain, increased hunger, taste problems, and drowsiness.
Some of the infrequent side effects are blurry vision, vomiting, erectile dysfunction, diarrhea, incomplete or infrequent bowel movement, difficult or pain when urination, and slow heartbeat.
In this slide, we can see some nortriptyline boxes with the different trademarks of the drug, for example, Pamelor and Primux. A box of 10 milligrams of the drug cost approximately $40.
Nortriptyline was discovered in the early 1915s by a group of scientists called Ron Pauling. Its psychiatric effects were first noticed in a hospital in Paris in 1952. Today, scientists are still investigating nortriptyline.
This is a great article from PetMasa that explains the mechanism of action in an X-ray structure view of dopamine. It is the most recently article about the nortriptyline, and they are still investigating this.
So, questions?
A short question about before the break. That will be 10 minutes break. A short question, please. From there? No? I will make the question. You talk a lot about TM, TM1, TM6, TM1. What is TM?
They are the helix.
TM means think of the membrane, think of the helix, and think of together, and you will find what's the meaning of TM. All these TMs. TM, TM. This is the membrane.
They are the neurotransmitters.
Now you are saying first that was an helix, isn't it?
Yes.
It's a transmembrane domain, un dominio transmembrano.
Okay.
It's a part of the protein that is through the membrane. So we are interacting. Can you say what is in a short
The nortriptyline blocks the movement of the neurotransmitters,
Which neurotransmitter?
the serotonin, the dopamine, blocking the movement of dopamine.
I'm blocking this receptor has these activities that they talk about, the antidepressant activity. Okay? So thank you very much. And now you have 10 minutes to